Hello, thank you very much for tuning to our channel. I'm Dr. Dan Eli, an OBGYN working with Bloom Women Health. I want to discuss with you today about a relatively common condition that is usually blighted ovum. Oftentimes, I get clients who happily come for their first ultrasound in pregnancy, and later on the doctors write and tell them that they have a blighted ovum. A blighted ovum is also called an embryonic pregnancy, meaning that the embryo part of the pregnancy is not formed. So it's a form of a pregnant loss, where generally a fertilized egg implants, and then in the uterus, as the embryo fails to develop, you find it is only the other tissues which are growing, and in the process the patient will continue to have the features of pregnancy, but will not be able to have a true embryonic part, that is the actual embryo growing, and in the process there will be no fetal heart. So usually it is termed as a blighted ovum. And you know that more than 50% of first trimester pregnancy losses are usually because of conditions such as blighted ovum. I'm always asked, what is the cause of this? Generally speaking, blighted ovum is a condition resulting from a chromosomal defect. And the chromosome which they have been trying to implicate is usually chromosome 9. And in the process, there is usually a problem with the actual development of the embryo. Of course, alongside the chromosomal factor, usually it has something to do with the development of the embryo. So usually either there should be an abnormal cell division of the embryo when there's a problem with the development, rather the cell division of the embryo that is formed, then it will mean that the baby will not be able to be formed properly, and therefore there will be a problem with the growth. In some situations, the studies have also related the blighted ovum with the hormonal disruption. So usually if you perform the serum estradiol levels, you find they're extremely very low. Same may apply to hormones such as progesterone. So the risk factors for these conditions are not very specific, because usually you find all categories of patients can be able to at times get blighted ovum. But in our studies, you find that a blighted ovum are more common in women who are older. And because they are more common in women who are older, we associate it with the quality of eggs. And so the commonest risk factor really is advanced maternal age. That is a risk factor which you can be able to associate with the blighted ovum. But overall, it can happen in any in age group. So it's not specifically related that if you are of advanced age, it will happen. It may not occur again, but we see the pattern more common in those people who have passed maybe age of 40 years and plus. And that is obvious because generally if a lady is above 35 years, the quality of eggs start dropping. So that is a commonest risk factor. Usually some of these patients, when they get to the clinic, Some do not have any complaint. They've just come to commence their clinic, normal clinic. They're not bleeding, they're not spotting, some even do not have anything like low abdominal pain. So it is usually very challenging to the couple, and it is even worse if maybe if the client, the female client, is alone. Maybe the husband is not there. At times they fail to understand exactly what we are talking about. Of course, there are other ways through which we can be able to make them understand. At times you can do what we call qualitative serum beta HCG. In this way, the HCG which probably maybe the couple did, the urine test which they did, that hormone can also be quantified. And usually as the pregnancy grows, around the 11th, 12th week, they're at its peak. So you would expect it to also be rising. So if for some reasons you have done the serum HCG, the beta HCG in the blood, and if you find that the levels are so low, it may be able to add up to the fact that there's something not correct with the development of the baby. So usually the couples will now ask me, so what do we do next? What do we do next, doctor? And usually what I tell them is I try to give them time. At times you can just have what is called a watchful observation. In some situations, even if you don't act, eventually they will start bleeding. So some go into natural miscarriage. Of course, it may also have its effects, because some people bleed much, and if you bleed a lot, probably at home it may be very dangerous. Or your doctor can advise that you're given some medicines to be able to induce the miscarriage, and when that happens, you will be taught about the side effects of the medicine, and maybe also manage the pain, because when uterus is contracting to expel the product, at times you get some kind of pain, and then you can be given medicines to optimize your pain control. Of course, surgically, which may be also another shorter means, they can take you into the theater or even in the side room and give you some pain medication, and then they can do what is called a vacuum aspiration. You create a vacuum and then you insert a small tube into the uterus, and when you do that, you'll be able to suck off the contents, because this is a very tiny pregnancy, actually just a sac with a fluid. So that's what we'll be able to do. So that is how we manage a blighted ovum. Usually after any person who has had a miscarriage, it is advisable that they wait at least for 3 months. Although WHO recommends like up to 6 months, but there are couples who at times come when they badly want to have a baby. So at times at 3 months, we recommend that they can now start trying to conceive. And then in these 3 months, what you need to do is also to investigate for any other possible causes of miscarriage that can happen. You don't have to wait for them to conceive first before you start investigating for things like syphilis. So you can be able to do all that and rule out things like clotting factors like antiphospholipid antibodies, and all those can be able to help you to avoid unnecessary repeat of the problem, and also give them supplements like folic acid. Dear friends, if this is your first time to tune to this channel, please subscribe, like, and share our video with somebody who would be able to benefit from such material. Thank you very much.